The gastrointestinal (GI) tract is a complex and vital component of the human body, responsible for the digestion and absorption of nutrients. Disorders affecting the esophagus, stomach, intestines, and other components can drastically affect these functions. Amongst these conditions, esophageal disorders such as dysphagia and odynophagia are worth noting. Dysphagia is defined as difficulty in swallowing and can result from neurological impairments or structural issues that narrow the esophagus. In contrast, odynophagia signifies painful swallowing and can stem from similar causes. One significant disorder of the esophagus is achalasia, whereby the lower esophageal sphincter fails to relax, preventing food passage into the stomach, which causes the esophagus above this portion to enlarge. Moving down the GI tract, peptic ulcers present another significant issue. These are ulcerative disorders found in the upper gastrointestinal tract, particularly the stomach and duodenum, areas exposed to corrosive acid pepsin secretions. Ulcers may affect either the mucosal surface or penetrate deeper to damage the smooth muscle layers. Healing of the muscularis with scar tissue is possible, although the mucosal layer can regenerate over the scarred area. A predominant cause of peptic ulcers is Helicobacter pylori infection, followed by the use of nonsteroidal anti-inflammatory drugs, NSAIDs, and aspirin. The most severe complication arises when an ulcer creates a perforation through the entire stomach or duodenal wall. Stress ulcers, known as Curling's ulcers, result from substantial physiological stress due to conditions like sepsis, burns, or surgical procedures. The most vulnerable parts are the stomach's fundus and the proximal duodenum. These ulcers can emerge due to ischemia, acidosis, or bile salt interactions in patients with reduced gastrointestinal motility. Cushing ulcers, a variant of stress ulcers, occur in conjunction with intracranial injuries and are attributed to increased gastric acid secretion due to elevated intracranial pressure, with potentially high rates of perforation. Irritable bowel syndrome, IBS, is a functional disorder characterized by persistent abdominal pain, altered bowel habits, and associated symptoms like flatulence, bloating, nausea, and psychological distress. The pathophysiology of IBS is linked to dysregulated intestinal motor and sensory functions, influenced by central nervous system communications. Stress plays a crucial role, often exacerbating symptoms through altered bowel motility and contraction patterns. In the colon, diverticulosis is a prevalent condition where the mucosal layer protrudes through weak spots in the muscular wall, forming diverticula, typically in the sigmoid region. When these pouches become inflamed or perforate, it results in diverticulitis. Intestinal motility disorders also manifest as diarrhea and constipation. Diarrhea involves frequent stool passage and can be categorized into large volume, which stems from increased water content, and small volume, associated with intrinsic bowel disease. Constipation involves infrequent stool passage due to inadequate dietary fiber, insufficient hydration, or muscular weakness. It is commonplace among individuals with limited physical activity and those who ignore the urge to defecate. Intestinal obstruction, labeled as either mechanical or paralytic, impairs normal intestinal transit. Mechanical obstructions arise from physical blockages from conditions like hernias and adhesions. Paralytic obstructions result from neurogenic disorders inhibiting peristalsis and can occur following surgery or due to inflammatory conditions. Strangulation can lead to necrosis, perforation, and peritonitis. Peritonitis, the inflammation of the abdominal lining, often results from bacterial infections or chemical irritants. The common causes include perforated ulcers, appendicitis, or trauma. This condition requires prompt medical intervention due to the risk of severe complications.